This podcast is a Christian view of the controversial subject of gender identity.
Welcome, everybody, to the latest episode of Stars, Cells, and God. This is the podcast where we explore how the latest discoveries in science provide evidence for God's existence, the reliability of Scripture, and the Christian worldview. My name is Rana. I'm a biochemist and a Christian apologist, and I work for an organization called Reasons to Believe. This is the organization that sponsors this podcast thanks to the generous donations of viewers and listeners like you. If you want to know how you can support this podcast or how you can learn more about Reasons to Believe, I invite you to go to our website, reasons.org. You can also follow us on social media, RTB_official. And then last but not least, please go to our YouTube channel, Reasons to Believe, and subscribe. Also use the notification button so that you are alerted when the next episode of Stars, Cells, and God drops. I have the pleasure of being joined, not in studio, but being joined via technology, via Zoom, by Dr. Steve Willing. He is going to be with us today as we talk about a really important, sensitive issue, namely issues relating to transgenderism and to people that identify as transgender. So, Steve, thanks so much for being here with us today.
My pleasure, Fuz. Thanks for having me.
Yeah, and Steve, you are a physician, that you are a radiologist, is that right?
That's right, a neuroradiologist. So my area of concentration has been brain and spine for 40 years of practice doing CT and MRI.
Okay.
Just trying to understand the human brain.
Yeah.
Find out what's wrong with them.
Great. Well, I think that's going to be really invaluable expertise as we talk about some aspects of transgenderism and, again, about some of the issues that people who identify as transgender struggle with. Steve, you also are the author of a book, Suburbia, right? Or Superbia, right?
Correct. Superbia. Superbia is a Latin term for pride, which was considered one of the 7 deadly sins. And the book is an exploration of how that sort of becomes the theory of everything when it comes to understanding human conflict, church struggles, civilizational struggles, personal failures, almost anything negative that you can think about in life or in organizations can be traced to pride at some point. Now, it doesn't explain everything literally, and it's often not the only explanation, but it seems to be present to some degree, a greater or lesser degree, in almost every situation in which troubles arise.
Okay, and so if people want to get a copy of that book, how would they do that?
It's on Amazon, and you just search for, the easiest way is to search for my name, Steve Willing, because I only have 3 books up there. One is an Atlas of Neuroradiology, which you're not likely to order by mistake. Another one is a little handbook, The Top 10 Myths of the Sexual Revolution. But Superbia will show up there, Superbia.
Okay, well, thank you. Well, Steve, I am so grateful that you're willing to spend some time with us today to, again, talk about this very sensitive but very critical issue about, gender identity, and that you are part of a team here at Reasons to Believe that has been working kind of behind the scenes for about a year or so now, really looking at a number of critical questions relating to gender identity issues, and that these questions involve questions about what Scripture teaches about gender, philosophical considerations, but also more importantly, medical and scientific considerations, which is why we have you here today. And, as an organization, we felt like this is really important for us to begin to engage in the whole gender identity conversation for a number of reasons. We think this is, again, a really critical science-faith question right now. But we were hesitant over the past several years to do this, but felt confident in doing this now because through our scholar community, we have access to people like you, Steve, who have the background and the expertise to really do a deep and thorough dive into these questions relating to gender identity and really give people what we hope to be highly credible, trustworthy information on this issue. And this is part of a larger project, really, where we're looking at what does the science about gender identity say relative to what Scripture says. So that's our interest in this project. But let me just ask this question as we get warmed up. Why do you think the whole question of gender identity is really so critical? What do you see as being really the linchpin concerns when it comes to gender identity?
Well, what has emerged as concerns are in the social situation where, say, folks who are born men want to participate in women's sports, or offenders who are born men wishing to be incarcerated in female prisons. Uh, there's also sort of the political uh, conflict that's arisen over it. And in the United States, it's really falling, it seems, along partisan lines. And that's not the case in most of Europe, where there's much more of a public agreement in places like the United Kingdom and Sweden and Finland, where they're backtracking on this. There you have a clash of ideas in what people believe. You have on one side people who believe that uh, little boys and girls can recognize that they are born in the wrong body, so to speak, that the little boy really is supposed to be a girl, or a little girl is supposed to be a boy, and they want to, treat them and start changing them early on, thinking that that will help them out in the long run. These uh, procedures are not without complications and dangers, both known and unknown hazards. On the other hand, you see people who say these poor confused young children are just mentally disturbed, and you're hurting them. That to do what the gender affirming community wants to do actually is just inflicting harm and borders on, if not crossing the border, into literal child abuse. So you can see why both sides would be very emotional. Both sides feel like they're on the side of the angels.
Yeah, yeah. And I think what really motivated us here at Reasons to Believe to get involved in this is that there are real life consequences to how we engage or approach this issue. So, we at Reasons to Believe, we take the view that human beings are made in God's image, that every human life has infinite worth and value, and that, we want to make sure that we are valuing each human life. And part of that is making sure that people really have the best information available to them as they make decisions that very well may be irreversible, that are literally life-altering, that out of love for people, we want to make sure they have, the best information. Steve, let me start with a really basic question, and that is, what does the term transgender mean? And I think maybe for many people, they think this is a frivolous question, but there's a reason why I'm asking that.
No, it's a really important question. On a literal level, it means someone who identifies with a gender other than the sex they were born. So what does that mean? Well, what it does is it conceives that gender exists independent of sex, that sex is something you're born with, determined by your chromosomes and identified by your external genitalia. Whereas gender is something which is separate and exists within the psyche. Uh, how this works exactly, you would have a very hard time pinning someone down on. It's kind of invokes the idea of some sort of platonic form that exists in the realm of being, as opposed to the realm we live in of becoming. It sort of invokes this idea that gender is something out there that is not dependent on your sex, but you can be a man or a woman or something else, and it has no bearing on how you present physically. So this idea that gender exists independently of sex, that it has some connotations. They reject the idea that there is a gender binary, that it's just male and just female. They also reject the idea of the human mind body as being one. It creates a dualism that the mind and body are separate, and also rejects the idea that male and female are distinct. It's that gender is a continuum. There's an almost or possibly infinite number of genders that can be assumed. That being said, 99% of the time we're still talking about a binary in the realm of gender. We're talking about a little boy who thinks or wants to be a girl, or a little girl who wants to be a boy. And for all the talk of a continuum, most of the time it comes down to one or the other. And the idea that there's a discordance, or could be a discordance between the two, not out of choice, but because that's how they were made, is what's being argued.
Yeah.
The word transgender didn't appear in the English language until 1974. This has really emerged in the latter half of the 20th century.
Okay, that's interesting to note. So then, how does the medical community understand today the idea of someone who identifies as being transgender? How do they view that individual?
Well, nobody can speak on behalf of the entire medical community, and what you're seeing right now is really a severe degree of division from full-throated advocates of the whole transgender idea that I described, that little boys and girls really are born sometimes in the wrong bodies, and you can't change the mind, so you have to change the body to bring it into accordance. So you have, kind of the extremists on one side, and on the other side saying, no, this is complete and utter nonsense, and it can't be engaged. Now, this is clearly not breaking down, say, upon religious lines. The skeptic community involves a lot of non-Christians, other religious traditions, atheists, political liberals. So it's not a religious issue really at all. You're seeing the United States as a nation, not as individual states, but as a nation, we're still kind of far on the idea of you proceed with early gender affirmation in children, whereas in other nations, we're seeing a severe retreat from this sort of aggressive treatment. UK has gotten a lot of publicity because of the Tavistock scandal at their Center for Gender Identity. Esteemed pediatrician who is president of the Society of Pediatrics in the UK, Hilary Cass, was commissioned to develop a report on this emerging scandal. And the final report just came out a month or two ago, where they say there's basically no good evidence that transitioning of gender in children is beneficial, that the harms are certain. And the National Health Service in the UK has essentially banned it for anyone under 16 or under. They can still get away with it in a private practice situation, and there are possibly moves in Parliament to close that loophole. So you're seeing a lot of retreat from that in the UK and some of the other European states as opposed to the US.
Yeah, and I mean, why do you think that is?
Why do I think what is?
Why do you think that there's a very different reaction in the part of what's happening in the UK with regard to gender affirming care versus what's happening in the US? Where it seems like gender affirming care is almost given as as the right thing to do, right? It's almost self-evident that this is the right thing to do.
Well, like everything in life, this boils down to why people believe the things they believe. And that's what I devote an entire chapter to in Superbia. Explain how we come to our beliefs, because we'd like to assume that all of our beliefs are based on facts, experience, and logic. But all the evidence, invoke evidence here, says that that's not true, that really emotions and social influences play a far greater impact, and sometimes are really determinative in how we believe these things. So it can be motivated by peer acceptance. I mean, the ones who are, say, leading the charge for gender affirmation is what they call transitioning kids. They don't call it sex change, because they say we're not changing the child, we're allowing the child to become who they really are. So it's called gender affirmation. Well, the ones that are leading the charge have a lot of possible motives. I mean, it could be for peer acceptance. It could be because they get a lot of publishing traction, so they can publish papers and advance in their fields. It could be a form of signaling their political identity. So there are a lot of implied motivations, but it's because I don't have a window into anybody's mind. I can only speculate. I cannot say to their speak with really authority as to what their reasons. And I think we also always have to give the benefit of the doubt that they believe they're proceeding according to the best evidence. But if they're not going with the best evidence, there are possible explanations why.
Yeah, I appreciate that. So, what is the occurrence in the population of people who identify as transgender, and how has that prevalence changed in recent years?
Well, there was a meta-analysis that was published in 2015 that looked at many countries between 1945 and 2014. And they found the overall incidence among both adolescents and adults was 4.6 per 100,000. So that's 0.0046%. So it was really low up until the mid 2010s. And what we see in the early 2010s, there's this rapid increase in those who are identifying as transgender, especially among young women. I'll show a screen right here. Um, This is the trend in LGBTQ identification by generations of US adults from 2012, 2017, and 2021. And what we see is a rapid rise from 2017 to 2021, the overall LGBT identification in Gen Z. So that's the youngest generation. Now, this doesn't mean exclusively transgender, and most of these are actually going to be bisexual. But we have in this next slide, I have a breakdown showing transgender itself. So we're not seeing this rise in the baby boomer generation. 0.1% self-identified as transgender among baby boomers, whereas among Generation Z, those who are born, say, after 1995, 2.1%. So it's 20 times higher than boomers. So it's been rising rapidly. You also see this rise reflected. This chart shows referrals to the Tavistock Gender Identity Clinic in the United Kingdom. And beginning when this opened, really it opened in the late 20th century, but they had less than a couple hundred patients a year, even as recently as 2011 or 2012. What you see around 2015 is there's this rapid increase, and this light blue area is females under the age of 12, or females 12 and over, I'm sorry. So females 12 and over. So almost all the rise is among young adolescent females. So something is going on here that we're seeing a rise. Now, there are a variety of possible explanations why that may be happening.
Yeah, yeah. Well, I mean, one obvious explanation would be, look, we just live now in an environment where it's much more socially acceptable to identify as transgender, right? Or there are options that are available, to treat or to, for gender affirming care, so that's why you see that sudden rise. That probably that number would have been that high within baby boomers and Gen Xers. It's just they weren't living in an environment where that was socially acceptable. So that's one, possible explanation. Do you think that's the explanation, or do you think something else may be going on?
We find that hypothesis invoked for all sorts of things, whether it's child sexual abuse or sexually transmitted diseases or premarital intercourse, and especially in areas pertaining to sex, but also in mental illnesses when you're seeing rise. I mean, that's always a valid hypothesis, but the hypothesis needs to be tested, and it can be tested, and it really doesn't hold up. The levels of acceptance have not appreciably changed. In fact, in the last probably 5 years, it's sort of reversed, where it's almost acclaimed, especially among the younger population, to quote, come out as transgender. I think another factor that's certainly been identified as a driving force is the onset of smartphones and then social media. and this has been identified. And Abigail Schreier, she wrote a paper, or I'm sorry, Lisa Littman initially wrote a paper called talking about rapid onset gender dysphoria, and it was described this rapid rise of young adolescent females who are identifying as transgender, and found that most of them had spent a lot of time on social media. And there are some notorious transgender influencers who are sounding the praises of this, talking about how cool it is, how exciting it is, how fashionable it is. They become extremely popular. They become what we call influencers in social media. So Lisa Littman wrote a paper about that. It was published in the Public Library of Science, and then it came out later with a book called Irreversible Damage, tracking this. So the social media seems to be very strongly correlated with the rise of young adolescent females in particular who are identifying as transgender.
So, uh, what does that say to you then as a physician if somebody presents as being transgender? And we want to be careful here because we're not offering medical advice, right? I'm just asking your opinion as a physician. What does that suggest? Because if people, again, do present as transgender, they really need to be seeking out their own their own physician to address their particular issue, their particular instance, their particular case. But what does that say to you in general terms about, look, if somebody is presenting as transgender, what should the response be, particularly if they now suddenly begin to ask for gender-affirming care or gender-affirming treatments?
The most sound advice, both for the patient, for the parents, for the healthcare providers, is to dive deeply into that individual person's story and background. Um, dig deeply into what other sort of mental illness might be going on. What's driving this? Because we find consistently that there are high levels of mental illness in those who present. In the story of the Tavistock Clinic, the investigative reporter Hannah Barnes, who wrote the book, talks about in detail how it seemed like that because the National Health Service in the UK wasn't especially attuned to treating children with social problems and mental illness problems, that the Tavistock Clinic, in effect, became sort of, I'm sorry to use the word, a dumping ground for kids who had a lot of other pathology. Many of them were in foster care. Many of them had been abused. So they are not otherwise well-adjusted kids who just had a problem with their gender identity. They were very deeply disturbed, troubled, traumatized kids who were also wrestling with the gender issue. And as it turned out, doing the gender affirmation, doing the hormones, affirming them in their new gender had little or no impact whatsoever on all the other uh, issues that were going on in those young children's lives.
Yeah, so and maybe we ought to do an episode on the ideology of transgender, of the transgender condition. But as you're pointing out, again, there seems to be contributing to this idea of struggling with gender identity, mental health disorders, as you're pointing out. So, what are the long-term mental health issues associated with being transgender? Are there long-term mental health effects?
The only really long-term study that we have is the Swedish study. That was a population-based study that looked at those who had been transitioned within the Swedish healthcare system over a period of several decades, ending in about 2010. And they did not do very well. Overall, they found that there was a 19.5 times higher incidence of suicide. The suicide attempts were 4.9 times higher. Psychiatric inpatient care was 2.8 times higher. The overall death rate was 2.8 times higher. So, and these were not people who had been denied care. They were given all the affirmation and sex change procedures and anything else that the Swedish system had to offer during the time that they were going on, still it had very poor outcomes. So this wasn't randomized. It proves neither that the treatments made it better or made it worse, but it does at least show that treatment really didn't um, bring them down to population levels of suicide or psychiatric inpatient care.
Yeah, and so I think this, to me is again in the spirit of what we're trying to do with this podcast and with this gender identity project is, really if somebody does present as transgender, that it seems to me like, again, there really is a deep need to do deeper exploration as to what is really happening with that individual before you start administering puberty blockers and doing some kind of gender reassignment surgery.
If I may, we could put this in the broader context. So Jonathan Haidt, who's an eminent social psychologist, he was co-author of The Coddling of the American Mind, and he also has been known for his book on their moral foundations theory. He has a new book out on the effects of social media. It's called The Anxious Generation, and there's an epidemic of mental health among the young people in this country, and this includes self-harm, suicide, depression, anxiety, and of this, the transgender is really just a small slice, although there probably is a common denominator in terms of some societal dysfunctions that are affecting kids and the effects of smartphones and social media. But overall, I mean, young people are showing suicide rates that historically the suicide rate among young men has been high above women, but now it's almost equal. It's risen so much among young women.
Yeah, that's, yeah, deeply disturbing, I think, no matter who you are, to see that, elevation in suicide rates. And speaking of suicide rates, there was a study published in April of this year, April 2024, in the journal Curis by, it looks like a research team from the University of Texas Medical Branch in Galveston, and they were exploring the effects of transgender reassignment surgery on suicide risk and suicide rates. So, Steve, tell us a little bit about the study, because to me, the results of the study are deeply concerning.
Okay, here's the paper that you're talking about. This was published by a group of emergency physicians. So they're the type who would normally be covering emergency rooms. They don't deal with gender care, they don't deal with sexuality. They do deal with suicide attempts, self-harm, completed suicides, PTSD, and some acute mental illness. What they had access to a database of over 90 million patients where the identifiers were removed, but it exists for research. And out of this, they identified about 1,500 people over a 20-year period who had previously undergone gender surgery. So that could be mastectomies in women. It could be, removing male genitals and trying to construct female genitals, or removing or breast implants in men, or like the cosmetic changes to reconstruct the face. It could be any number of things. And what they found was kind of across the board, they compared to the population, various control groups who had not had these procedures, they were overall about 5 times to 10 times more likely to have had a suicide attempt, or engaged in self-harm, or present with symptoms of PTSD. Now, this is a snapshot in time. This doesn't show that they got worse. You can't infer causality from this, so it doesn't provide us very much information as to whether the surgery actually made it worse, because what if they had, if the suicide rate was, say, 10 times higher than the control group, well, what if they hadn't had the surgery? Would it be 20 times higher? That would be a hypothesis if you wanted to support the surgery. And it was not really testable by the means that they had. What it does show is what we see kind of consistently is that whatever the a gender affirmation may do, if it confers any benefit at all, it certainly doesn't take them down to baseline, what we would call baseline levels of where you would expect the suicide attempts to be in the general population.
Yeah, and no, I appreciate how circumspect you are in terms of interpreting that data, but as you said, this isn't exactly what I would have expected if indeed the whole narrative that by engaging in gender affirming care that actually solves the problem that the patient is suffering from when they identify as a different gender. I mean, this is not the type of result that you would expect to see if indeed, gender affirming care actually improved the mental health of the person.
I have some other things I can show briefly that do address that issue. And this, many have commented how the quality of research in this area has been abysmal, with no control groups and poorly designed studies and multiple variables. Some of you may have heard the old axiom: if you torture the data long enough and hard enough, it'll confess to anything. And that seems to be what is happening here. Let me show you a couple of examples. This article appeared in Pediatrics in October of 2020, called "The Mental Health and Timing of Gender Affirming Care." What did they do? They simply looked at children who were presenting for gender uh, treatment, for gender affirmation treatment, but it was one-time snapshot admissions. It was kids who were presenting with no past history. So of the kids who are less than 15 years old, 30% had major depression, 40% considered suicide, 9% attempted suicide. You see the pattern. Over 15, a higher percentage were depressed, had considered suicide, or 40 higher percentage self-harm. So the inference here is, well, we should begin, they're arguing on basis of this that, well, we should start interventions early because otherwise it'll be higher if they're older. Well, this is true of anything, whether you're talking about schizophrenia or lung cancer or gallbladder disease, any illness. The older people, the older population you look at, the more likely that they will have had it or have it at some point. So this is just pure nonsense that you would infer that intervening early would bring these rates down. You would want to look, say, at a control group. You want to look, if you could say those who were not gender dysphoric, if the rate stayed exactly the same, which it wouldn't, but if they did, then you would have an argument. Another example, this was from a major multi-center consortium and involving some fairly prestigious places like University of Chicago, Harvard, UCLA, UCSF. This was published in the New England Journal in 2023, so just last year. Psychosocial functioning in transgender youth after 2 years of hormones, and they were claiming to have shown improvement by putting children on hormones. Well, this study has just been eviscerated by critics who've gone back and looked at the methodology. They began the study looking at multiple variables, but they simply don't report on the variables. Many of the variables were just left out and ignored. So you're left with no information. It's possible that they got worse in many of the parameters. Another criticism and a real concern is that out of the 315 patients in this, 2 committed suicide, and these 2 were on treatment at 6 months and 12 months after treatment. So they're arguing that this is necessary to prevent suicide, but then it fails to prevent suicide. And this is a much higher rate, actually, than in the Tavistock clinic, where they had 2 suicides out of 7,500 patients. Another criticism was that the improvements they were measuring were really extremely small, say an improvement in the depression score of 0.5%, which may be statistically significant, but it wouldn't be clinically significant. Here's another study from Seattle. This was published in the Journal of American Medical Association. So these are articles are getting a lot of traction, nationwide publicity with press releases in the major journals. This is another article that was touted as showing an improvement in mental health among those receiving gender-affirming care. But what does their table actually show? I don't know if I can do a pointer. I don't know if you see my pen. Here's a pointer. Let's change that. So at the baseline, we start with 10 who are on puberty blockers or gender assisting hormones and no treatment in 92. Well, at the end of 12 months, 57 are on treatment and 6 are not on treatment. So there was a tremendous amount of dropout. They went from 99 at entry to 63. What happened to the missing kids? We don't know. Well, most of the missing kids presumably were the non-treatment. So they say that the kids got better. Look at this table. At baseline, 57% or 59% has moderate to severe depression. At the end of 12 months, 56%. This has not changed. Severe anxiety, 57 or 51%, still 51%. Self-harm or suicidal thoughts went from, say, 43 to 45, maybe down to 37. These are not significant changes. What was their argument? Why did they say that they made the kids better? Because they were arguing that the kids who did not get treatment did worse. And if you look at the right-hand side, you'll see, well, yes, you see higher rates of depression, anxiety, and self-harm and suicidal thoughts in the untreated group. But you're only left with 6 kids in this group, and we've lost a large number. Without knowing this data is kind of meaningless. And many people have pointed this out, and these are just examples, some of the more egregious examples that I could point out, but it's really problematic. And given that we know that once the child's brain is very malleable, very plastic. This is true for a lot of things besides sexuality. And we know from historical data that most children with a gender dysphoria will remit, will become at peace, at ease with their birth sex by the time they reach adulthood. The desistance rate ranges from at least half up to as high as 98%, depending on which study you choose to invoke. So the desistance rate is really high. But what they found in the Tavistock clinic is that once you embark upon this program, once you begin with the social affirmation where they get to change their name and dress as the opposite sex and be addressed and treated as the opposite sex, once you go down this pathway, practice makes permanent. You're actually reinforcing this transition from male to female or female to male. You're reinforcing it, which is diminishing their chances of becoming at ease with their physical body. Well, why would that be harm? Because by far the optimal solution is for them to become at peace with their physical body, because all this messing with the hormonal milieu and their bodies, it comes at a cost. It comes at a huge cost where the benefits are really very difficult to prove.
Steve, I appreciate your perspective on this. This has been very enlightening, to me, and hopefully enlightening to our viewers and our listeners. Couple of some wrap-up questions here. One is, again, maybe if you could offer some kind of summary statement as to the bottom line of what we discussed, and maybe, again, the bottom line for if somebody presents as being transgender, what is in general terms the best practice that we should take?
I mean, speaking now just as a human being and not as a physician or counselor.
However you want to speak, whatever perspective you want to take.
The general principles of Christian charity need to apply. Regardless of where they're coming from, we never should look upon such people as evil or the enemy. We're all deceived. We all fall prey to various deceptions. I mean, and there are so many forces at work. It's hard even for the most critically minded individual to sometimes to sort out truth from falsehood. And there are all sorts of forces out there trying to deceive. I talked about the impact of social influences and social media and smartphones. And Jonathan Haidt, again, in The Anxious Generation, talks about the elimination of play-based childhood and transition to screen-based childhood. They're becoming sort of relationally impaired to an extent no prior generation had to deal with. So many of these are growing up without their biological mothers or fathers or in mixed situations, and that's been known to increase the risk of all types of psychiatric morbidity. So ultimately, it's one of compassion and in patients, but I think we also have to be very concerned, do what we can within what the privileges of our relationship might allow to try and keep them from going down a road that could be really self-destructive.
Yeah, yeah. I heard a great presentation by a woman named Katie McCoy, who's a theologian. And her point was that there is a deep connection between the struggles that people have with gender and really what the gospel offers. In this sense that, what people are saying, when they struggle with their identity, their gender identity, is that something is wrong, with me, and that it's going to take something radical to change me, right? And that's really what the gospel is about, that all of us have something deeply wrong with us, and that we do need a radical transformation, and that radical transformation is offered through the gospel. And we share this information, again, not to engage in the culture wars, but rather that people need to understand that there is that deep connection between mental health disorders and people that present as transgender, and that before people go down the path of gender-affirming care, that maybe there are other things that need to take place, for the best interest of the child, who is struggling with these issues.
Agreed. And study after study shows that those people who are religiously active of all ages have much better levels of mental health and social functioning and healthier relationships, greater levels of happiness, just overall doing better in life.
Yeah, yeah. Well, Steve, I really appreciate you taking the time to be with us, and really appreciate the hard work that you've put into this whole issue, the level of work research that you've done, and the gentle manner in which you're presenting this information to us. So thank you so much for being with us and for being part of the work that we do here at Reasons to Believe. I deeply appreciate that.
Oh, you're welcome, and thank you, Fuz, for all that you do.
Yeah, well, thank you so much for all of you for watching this episode of Stars, Cells, and God. We'd be very much interested in your thoughts on this conversation. You can list your thoughts, give us your ideas, raise your questions in the comments section. And also, while you're at our YouTube channel, Reasons to Believe, make sure you subscribe and use the notification button so that you're alerted the next time a new episode of Star Cells and God drops. Also, follow us on social media, RTB_official, and visit our website, reasons.org. Until next time, remember that the more we know about science, the more we have reasons to believe.